Okay, some foam rolling exercises for your spine where you're trying to loosen up the upper back. So in particular, this is for anyone who really feels super hunched over, what we call kyphosis, rounded through the spine, shoulders falling together. Now, I'm not a huge fan of foam rolling. I don't think it's going to fix anything. I don't think it's going to be the cure-all that some people say it might be. However, I do like to do it as just little ways of bringing blood flow and kind of sensation to areas that we mightn't really have felt before or might be lacking, or kind of dead zones, something like that. It can also highlight where is really tight for you. So you mightn't exactly know intuitively, but the more awareness we can bring to where our body lies in space, then the easier it is for us to start to develop change or ask for a change out of our body. So if I don't really know that my chest is super tight and pulling my shoulders together, well, then I might not know how my position is. I might not know where my posture is. So just developing little increased awareness of how we lie in space is huge. And I think the foam roller can help with that. Okay, so what we're going to do just for this spinal mobility session, we're going to take foam roller. Here we have my beautiful homemade foam roller, big piece of plumbing pipe wrapped around with an old yoga mat and then taped together with some duct tape. So if you're stuck, you need some homemade foam rollers. That was a pretty easy solution. We're going to start. A lot of people feel pain in the lower back when we've got tight upper back. So we're going to start on the obliques and try to move towards the QL, which are the kind of erector muscles along the back of the spine. I don't want direct pressure on the lower back. I just instead want you to think about trying to increase the space between your lower rib cage and your hips. And again, it's more about trying to build that awareness, trying to understand the concept of developing space through the trunk and foundation of the body rather than having everything collapsing on top. If we can start to fit that foam roller along the musculature of the trunk that runs between your ribs and your hips, you might start learning how to get more length through the center of the body. Okay, and you're going to hit that about 30 seconds each side. What I mean by that length, oftentimes we just collapse in here, right? And when you feel that, now my ribs are basically touching my hips, but we have a lot of space in there, and I want you guys to start understanding that a little bit. That exercise of getting the foam roller in that musculature there, in that space, that can help understanding how to get nice and tall. From there, you're going to do both sides, obviously. From there, we're going to move up to the lats, okay? And here, this is just a case, again, where it's super tight. I'm trying to find what I'm feeling, what I'm not feeling. So dead zones. If I have a portion of the body that I generally don't feel or have control over. Now, it's usually quite a knotted up scar tissue place, quite tight, the lats here. I like to just roll from side to side first, and then up and down. When we find a super tight space, bring in some movement. Again, both sides there. From there, we're going to move to the mid-back. You're going to hug the shoulders and just rolling side to side. Remember, we want to stay away from pain. There's going to be spots that are super matted up. But we don't really want to be in a place where creating so much tension that it's everywhere in the body. We feel like the neck holding on, the face holding on. I don't believe that we're doing any good to the body. I think we're just taking tension from one place, putting it in the other. From there, we're going to move to the front of the body, okay? Again, open up that space. And this time, I'm just going to let myself sit on to the foam roller, trying to again find that space between my hips and my ribs. Maybe a little gentle massage. Trying to get in towards the psoas. I'm just swaying slightly from side to side. And open up all of that anterior chain, that front side of the body. Okay, and then from there, we're going to take your tennis ball and you're going to try and find your psoas. So a little trick I use for that: 2 fingers on the belly button, 2 fingers to the inside of the hip bone, then take the thumbs, push them in to meet each other, and woof, there it is. Right around there you should find the psoas. Get a little medicine ball, softball, whatever you have, start to lie on it. And again, we're just going to breathe into that, allowing that to relax. Once you feel a little bit of relaxation, we can start to bring the leg up and down. You can start to bring the hand up and down. Hand and leg together. Again, we don't want tension to be so bad that we're wincing in pain, okay? It should still be somewhat pleasurable, all right? Use this as a way of building your proprioception, your mental map of where your body lies in space, okay?